each one of us, if God forbid we get a serious illness and none of us know when or how, I didn't ever imagine it would be me, non-smoker, relatively good eater, worked out every day, that if it happens, God forbid, each of us is entitled and deserves the best possible care, not just of our body, but of our spirit and our soul.
Ken Swartz talked and demonstrated how the time spent by doctors, patients, other healthcare workers was every bit as important, if not more important to him than the drugs that were going into his veins. And that's a message that is timeless.
We at the Schwartz Center have to elevate compassionate healthcare to a national priority, to make it a fundamental element in the design of systems of care, the provision of healthcare, the measurement of healthcare quality, patient outcomes, and the education of all healthcare professionals.
I think it's job number one, top of the list, for healthcare leaders to be focused on compassionate care and to make sure that it gets delivered for every patient in their institutions every single day. If we make it a priority, and if everybody who works for us in the organization understands that it's a top priority, and if we make sure that additional leaders that we bring into the organization both understand and can be committed to making that happen, I'm absolutely certain that the business challenges that we face today will be mitigated by virtue of delivering higher quality, more compassionate care to every patient who comes to us.
I think that's one thing that the Schwartz Center has learned and has taught others, is that for so long we always felt that compassion was innate, and that the ability to connect a patient was something you either had or didn't have. And that's wrong. Just like any other skill in medicine, communication and connection absolutely can be taught and it can be role modeled.
I would suggest that our best hope is that we can both elicit and teach compassion. Because I believe if we do not do a better job of identifying and eliciting compassion, that we have no hope of ever designing a health system that's going to act in a compassionate way.
What a novel notion that clinicians, hospitals, health systems will be rewarded for keeping patients well and keeping patients content and having them feel secure in the care that they're receiving.
What the rounds do is create an opportunity for doctors, nurses, social workers, and other caregivers to come together and explore the side of clinical care which we really have no place else to do. To talk about what it means to be caring for a colleague, what it means to be taking care of a patient who's facing end-of-life experience, what it means to make a mistake and to recognize that and to move on and still provide outstanding care to patients.
The more you're centered on patient, not only is the patient better off, not only is the work more satisfying, not only do the outcomes improve, costs fall. In this country, every country is looking for solutions to this dreadful healthcare problem. The answer lies in what the Schwartz Center does. It's putting the patient at the center.
Dr. Partridge has always been very gracious with including my parents and my now husband in every conversation, but also saying, we're going to have an exam now, so why don't you leave? And then she'll close the door and say, how do you really feel? I know you can't tell them how scared you really are because they're invested in this. She also knows that this involves the whole family.
It's absolutely critical that an organization commit the tools that are necessary to help those patients and their families migrate across the healthcare system and stay connected. That it will be incumbent on every healthcare provider to make sure that the institution has the tools that are necessary to give patients and their families the resources that they need to be able to move from the physician's office to the inpatient setting to the emergency department so that they can navigate what is otherwise an extremely complicated and intimidating healthcare system.
I think I would remind caregivers that patients are strangers in a strange land, and that they are surrounded by equipment that looks odd and by people who are providing care who speak a different language. It is an awesome and intimidating and frightening experience to be a patient, and it's our responsibility to see patients through it safely, compassionately, and to always put ourselves on the other side of the Johnny, as it were.
We lack access to meaningful measures to help us know something about some of the most intimate and personal experiences of our lives, our health and our health care.
If we can understand patients' perceptions of what compassion is, we could then help people learn how best to provide it and organize our care and our care delivery to maximize that possibility. There's a lot of work that needs to be done to correlate empathy and compassion with patients' health outcomes. It's not the only part of the story, it's one part of the story. Some might question whether we really need evidence to support the necessity of compassion. Why isn't it just a given that that's a good thing? But there are people who would like to see some kinds of correlation with patient health outcomes. It'd be a huge contribution, actually. A huge contribution to healthcare if we could figure this out.
This idea that you can provide highly competent technical care without concern about providing compassion or without really thinking about the patient as other than just a sort of a body that needs to have medical care given, I think is over.
So I think the Schwartz Center is the perfect antidote for this changing world of medicine, because it reminds people that it's really all about the doctor-patient relationship. That is so key and so important when it comes to giving great care and really thriving under great care.
I have never found an organization like the Schwartz Center, never.